Good evening, this is Saraf from Majumdar News. Accessing treatments for rare diseases in Canada remains a complex and challenging process, often leaving patients and their families navigating a labyrinth of regulatory hurdles and financial obstacles. In Canada, a disease is classified as rare if it affects fewer than 1 in 2,000 individuals. Despite the existence of over 7,000 identified rare diseases, many of which are life-threatening or severely disabling, patients face significant challenges in obtaining necessary treatments. Health Canada approval. Pharmaceutical companies must submit clinical trial data to Health Canada for review, a process that can take between 12 to 24 months. While some treatments receive expedited consideration, many undergo standard timelines, delaying access to potentially life-saving medications. Insurance coverage. After approval, it's up to individual provinces or territories to decide if a drug will be covered under public healthcare plans. In cases where coverage is denied, patients are left to pay out of pocket or depend on private insurance, which may not fully reimburse the expenses. A recent case in British Columbia highlights these challenges. A 9-year-old girl suffering from a rare disease is set to lose access to her life-saving treatment due to impending government funding cuts. This situation underscores the urgent need for increased awareness, policy reform, and enhanced healthcare strategies for rare disease patients. Advocacy groups, such as the Canadian Organization for Rare Disorders, CORD, emphasize the necessity for a more streamlined and supportive system. They advocate for the implementation of dedicated rare disease policies, similar to those in the United States and Europe, where programs like the FDA's Orphan Drug Program and the European Medicines Agency's Orphan Drug Pathways have facilitated accelerated approval and access to treatments. The intricate process of accessing rare disease treatments in Canada highlights significant gaps in the current healthcare framework. Addressing these issues is crucial to ensure timely and equitable access to life-saving therapies for all Canadians. We will continue to monitor developments in this area and provide updates on efforts to improve access to rare disease treatments in Canada.